welcome back to Face It with Dr. G. I'm Dr. G, and so excited to be back here today. Let's talk about some fun skincare things. I was thinking there's a lot of talk about skincare ingredients recently, I feel, popping up on my Instagram feed, and a lot of questions in office where people are really sitting in my chair and in our team's chairs and just saying, just tell me all the things. I just feel dull. My skin feels dull. I want to look brighter, and I just need you to tell me what to do. Because with all of the resources we have nowadays, specifically TikTok, which all of the nonsense on TikTok, you guys, you really have to get through the weeds and get out of the weeds and into clarity when it comes to knowledge and truth about skincare ingredients. And also Google. Dr. Google is really not great most of the time. And I often tell my patients, you're paying to be here, or you're paying for a treatment. I want to tell you the truth, right? I love that you try to do your research. It tells me that you're invested in this and you want to know so many things. But let's get the truth, right? So I wanted to talk about retinoids and essentially interactions of other ingredients, specifically with retinoids. Can you use or can you not use these ingredients with retinoid? And as we know, retinoid is a family of vitamin A derivatives that includes retinol, includes things like adapalene, includes things like tretinoin or retinoic acid. So it's a family. And oftentimes in medical aesthetic practices, we offer retinols, which, as you guys know, if you've listened to my podcast, retinol is the inactive ingredient. Your skin must convert that into retinaldehyde and then into retinoic acid, which is the active ingredient. So most of our patients are using either retinol or retinoic acid, or tretinoin, which is the prescription. And oftentimes they say, oh, I heard I can't use it in the morning, or I can't use it with a vitamin C, or I can't use it with blank. So it's not really that you can't use certain ingredients together. Every single skincare regimen for a patient is customized. Everyone is different. And yes, we have categories like, okay, I'm oily and sensitive, which is specifically really hard to treat. I have rosacea, or I'm really, really dry, or I pigment really easily. And we go into these groups and categories, but at the same time, everyone is unique. Not only that, but people can have allergies or sensitivities to ingredients. So you have to understand what that patient needs specifically. And a part of your history taking is understanding what they've taken in the past, what has worked, what hasn't worked. And when they say why it has or hasn't worked, ask another question. Say, okay, this worked for you. What happened? Okay, this didn't work for you. What happened, right? You can't assume that you know the answer to those things. And that is what I've learned the most, I think, through my journey in medicine is don't assume, don't go to textbook, ask the patient. If you have a patient, right? As a pathologist, I didn't really have patients, but ask your patients because they have the answers. And if they don't, then you can help them figure it out by asking more questions. So ask questions. That's the takeaway from today. So anyway, let's go back to the retinol. So biggest thing, can you use a retinol, first of all, in the morning, or can you only use it at night? And the answer is yes, you can use it in the morning. However, retinols do make you a little bit more sun sensitive, regardless of what people say in the historic formulation. But we have a lot of new formulations for retinol and retinoids, and it's called encapsulated. So encapsulated retinols, it's a form of delivery of the medication or the topical ingredient that is, it's a slow release. So your skin is not subjected to this ingredient, wham bam, all of a sudden making you super sensitive to other potential ingredients. It's a slow release over time, extended release. So that's really great, and it also protects the integrity of that drug and the molecular composition. And this is important when it comes to vitamin C, and we'll get there. So retinols can be used in the morning if you're using an encapsulated form of retinol, and hint, hint, we're working on those types of things with Soy Air Skin, so we're super excited, so stay tuned. But if it's not encapsulated, I would still recommend using it at night, and you can use it with a cream before and after in the sandwich method or not. And I recommend starting once a week and getting up to every night. But that is something to know. You can use it in the mornings if you want. Now, let's say you use your retinol. You're like, oh, I'm so cool. I have an encapsulated version of retinol. I'm going to now use it in the morning, but I use my vitamin C in the morning. Oh no, can I do that? So here you go. Vitamin C, L-ascorbic acid, is an extremely unstable ingredient. It is reactive to light. It is broken down by UV rays and can cause, those byproducts can cause reactivity and sensitivity with your skin. So it's not a matter of can I use it in the morning, it's a matter of what do you use it with. So if you're using a vitamin C in the morning, I would recommend use your retinol at night. You don't want to make yourself too sensitive. Now if you're using it and you're fine, okay, just continue to use it, that's fine for you. But if you are now saying to yourself, okay, I want to use my retinol in the morning because I'm cool and I have an encapsulated version, and I'll use my vitamin C at night, that's totally fine. Vitamin C still works at nighttime. You can use it then. I don't necessarily recommend using vitamin C morning and night, especially when you're beginning, but you can do it if you want eventually. Again, just understanding if you put that with other ingredients and other products, and you go in the sun, you can become really, really sensitive. So again, almost trial and error, I would start on the slower side of things. The other thing about vitamin C, again, if you've been listening to me for years, you probably know this, you want to have your L-ascorbic acid stabilized by at least, at minimum, ferulic acid, and hopefully adding in another antioxidant to sop up other oxidative stress and byproducts, reactive oxygen species in your skin, like a vitamin E. So then let's talk about cleansers and other ingredients in the cleansers. So specifically things like alpha hydroxy acids. So glycolic acid and lactic acid, mandelic acid. These acids can be found in cleansers, and they can be found as topical serums and in some moisturizers, eye cream. They're kind of all over the place. And that's almost this sneaky little culprit that we don't realize can make us super sensitive. Because glycolic, honestly, can be in everything, and people think, oh, it's great, it's just going to give me this light little superficial exfoliation, I won't have any side effects. That's not true if you're using that on top of 10 other ingredients that have exfoliating agents in them and a retinol. So glycolic acid with a retinol can be fine. Again, if you're using the retinol let's say you're using retinol at night, use something in the morning with glycolic acid that has a gentle exfoliant, or use it every other day. But that exfoliating property of a glycolic can make your skin a little brighter, right? It is nice, makes your skin a little smoother, but retinols also have exfoliating properties. So you're already, and those properties of the retinols are more effective. So you're already now doubling up that effect of exfoliation, which ultimately you could break down your skin barrier, your moisture barrier, acid mantle, all the same thing, which then cause dryness, irritation, redness, eczema, superinfection, etc., etc., etc. So those alpha hydroxy acids are one to be very aware of, and I specifically use it in a cleanser. We have a beautiful one, Nettoyant Exfoliant with Soil Your Skin, but it's in tons of stuff. I'll use it as a cleanser once every other day, maybe, or every 2 days, because to me, retinol is more important to use every night than using a glycolic in the morning. Does that make sense? Retinol is more important to me every day than a glycolic or an alpha hydroxy acid, meaning I will forfeit that ingredient for my retinol. Why? Because a retinol also does that, and a retinol has anti-aging properties, smooths fine lines and wrinkles, helps with collagen stimulation, helps reverse precancers. It helps fortify the skin. It is the most effective ingredient that has all of the jobs and roles and does all of the things we want. So that's what I think about glycolic acid. Now let's go to salicylic acid, which we refer to salicylic acid as a beta hydroxy acid. It's not technically structurally a beta hydroxy acid, but that's a whole other topic. So salicylic acid is a gentle exfoliant that is oil loving, oil soluble, lipophilic. All of those words mean the same thing. So salicylic acid in an oily patient helps to combat that oil and the debris and the gunk, because it can get in the pores, it crystallizes it, and it helps dissolve and get rid of the oil. So patients that are super oily using a salicylic fortified cleanser is great. Now, you don't want to use another ingredient that has glycolic, another product that has something like glycolic or lactic or mandelic, because not only are you already acne prone and oily, you're then going to over exfoliate and damage that skin's ability to keep the moisture in the skin. So let's say you're acne prone and you want to use a face wash and you also want to use your retinol, and you're like, okay, well, salicylic acid in the morning, retinol at night. They're both exfoliating. Yes, true. But of all the exfoliators, salicylic acid is actually less than something like a glycolic or mandelic. Those are a little bit more irritating. They're more on the surface, and something like a benzoyl peroxide stays on the surface. Salicylic acid doesn't, because it gets in the pores. So in my opinion, it would be okay to use a salicylic acid in the morning and a retinol at night without a problem. Then you say to me, okay, well, what do I do when I wash my face at night then? Do I use my salicylic acid again at night? And my honest opinion would be no. I would use a gentle, creamy cleanser that doesn't have a lot of active ingredients. So salicylic was your active that's in the morning. Retinol is going to be your active at night. And a gentle cleanser to break up the grime and the debris and to fortify your skin health. Something like, we have Lait de Macquillon, which is our gentle cleansing milk. It's kale based, has vitamin K, lutein, natural brighteners. Your skin feels like silk afterwards. And no, this cleanser is not meant to attack your acne prone skin and solve acne, but you don't need that because you're then using your retinol, which is doing that job for you at night. I hope this is clarifying things for people. I can like feel light bulbs going off. So that is my idea when it comes to salicylic. The other thing for people that have, let's say, a lot of oil production, a lot of sebaceous gland activity, and they say, how can I cleanse in a different way? And this is counterintuitive, but oil cleansers on oily skin are actually incredible. And the reason is that oil loves oil, and oil can get into the pores again and sop up that oil and dirt and grime and dead skin cells and actually help loosen it so it can be extruded from the pores. So if you're oily, please don't, first of all, ask your providers, your dermatologists, your aesthetic providers, people that you trust and know their stuff. And if they don't, have them listen to this podcast. But you should not be scared of oily cleansers. If you have oily skin, it'll actually improve your skin over time. Okay, so let's do one last ingredient, and let's talk about hyaluronic acid. Hyaluronic acid is a staple, it's a must. You know, there's some naysayers that say it doesn't do anything. I completely disagree. I see it day to day in my practice. It's so powerful. It's an extreme hydrator. Every single molecule of HA absorbs 1,000 times its molecular weight in water. And our skin needs hydration, especially as we get older. So hyaluronic acid and a retinoid. Those are great, right? Because hyaluronic acid is a hydrator and retinoids can tend to be a little bit drying at the beginning, so these should be two little peas in a pod and go really nicely together. The one caveat I will say is, as you're getting used to these ingredients and as you're getting used to specifically a retinol, hyaluronic acid can make you more sensitive to a retinol because your skin is really hydrated. It's working very efficiently, your cells are, and you can react a little bit more aggressively to the retinoid at the beginning. This will subside, so stay loyal to it. Slow and steady wins the race. Decrease the retinol frequency if you have to at the beginning, but stay with it. The HA and the retinoid can be used together. You can use your HA in the morning and at night, and this is a beautiful combination. Then last but not least, I will say sunscreen. Do not forget your sunscreen. That is morning. Gosh, you can use it at night if you want to, if this is really something that you're interested in, but you don't have to. But sunscreen is the most important, as is a retinol. So if you can really only afford 2 products, I would buy a hydrating sunscreen and a retinoid or a retinol. Those are going to keep you fresh and youthful and doing all of the things that your skin wants to be doing to maintain a complexion over time. So I hope this was helpful. I can do, I guess, more like this with skincare ingredients, kind of off the cuff. And I think when we start becoming overwhelmed with so much information and all these fads and this and that, you have to bring yourself back to the science, back to basics, back to understanding. Simplicity is often the answer, especially when you're dealing with complicated skin and you're using 300 different products. Bring it back to basics, slowly add products one by one, and it'll get you to the perfect spot. So like, listen, subscribe. Thank you guys for everything, and I'll see you again next time.